name's Cheryl McQuire. I'm a research associate in epidemiology and alcohol-related outcomes here at the University of Bristol. So we've conducted a study recently with children of the 90s data that look at some of the effects of drinking in pregnancy. And specifically, we were looking at how many people might be at an increased risk of a group of conditions known as Fetal Alcohol Spectrum Disorders, or FASD. So FASD is an umbrella term that describes the range of effects on the brain and body that can result from drinking in pregnancy. So people with FASD will have problems in a range of different areas of learning and behaviour, so all individuals with FASD will have that. Some might also have growth deficiency, so they might be a bit shorter than average, or they might have a lower BMI. And also a minority of people, around 1 in 10 with FASD, will have quite distinctive facial features, which include small eye openings, a thin upper lip and a smooth philtrum. And these are the individuals that are most commonly picked up by, for example, paediatricians and GPs, but it represents a really rare subtype. And it's actually quite a misconception that these are the only people with FASD, and for that reason, FASD is thought to be a largely hidden disability. So we found that drinking in pregnancy was common. So up to about 79% of mums reported drinking some amount of alcohol at some point during pregnancy. And this really is consistent with what we found from other UK studies. And it's also consistent with review evidence that shows that the UK has the 4th highest prevalence of drinking in the world. And then in terms of FASD, we found that among children, up to 17% had symptoms that were consistent with FASD. So it's really important to say that this screening estimate is not the same as a diagnosis. So a diagnosis requires quite an in-depth assessment by FASD experts. But nevertheless, it suggests that fetal alcohol spectrum disorders are likely to be a lot more common than previously thought. So a lot of people have argued that FASD was wrongly thought to be a rare condition, and that because of this, there aren't the resources in place to identify and support those who have been affected in order to help them achieve the best possible outcomes in life. Really, we want to use this as a stimulus for further research so that we can get more evidence about this largely hidden and complicated condition. We also know that the government are producing new alcohol strategy guidelines, so we hope that this type of work will help inform that kind of policy to help improve the resourcing and outcomes for these individuals. I'd just like to say a big thank you, because we looked at a range of different ways of trying to get the first estimate of fetal alcohol spectrum disorders in our population. And really the children of the 90s data were really the only comprehensive resource that we could use to answer our question properly. So just to say a big thank you for all of the information that they've provided to help us understand this condition a little bit more.